Anesthesiologists are specialist physicians trained in looking after patients before, during, and after their surgery. A detailed anesthetic assessment is important so that we can tailor an anesthetic to both you and your surgeon's needs, and this helps us do a successful joint replacement surgery. An anesthetic assessment may happen a couple weeks ahead of your surgery in the consult clinic, or it may happen the day of the surgery. During this assessment, we'll go over your detailed health history, which will include any medications you might currently take, your current cardiovascular fitness, any medical conditions you might have that would impact a safe anesthetic, as well as any anesthetic histories that you may have, particularly if you've had any difficulty with anesthetic or been told that you've been a difficult intubation or have an allergy to anesthetic or pseudocholinesterase deficiency. We will also perform a physical exam at that time, examining your heart and your lungs, and we'll review your lab work and order any additional lab work that we feel might be necessary to ensure that you have a safe anesthetic. Questions for you, and then we'll talk about your options for the anesthetic today. You will also have time during this assessment to discuss your anesthetic options with the anesthesiologist and ask any questions you might have related to the anesthetic. Anesthesia is not one size fits all. After all of this information is gathered, we'll tailor an anesthetic specifically for you based on your needs. One of the options you might be offered is called general anesthesia. General anesthesia is a form of an anesthetic where you're unconscious for the surgery. This will involve us giving you some medications through your intravenous or your IV that make you fall asleep or go unconscious. After you're asleep, we do help your breathing with a breathing tube, so one of the common complications from a general anesthetic includes a sore throat and possibly chipping or damaging your tooth from placing the breathing tube. When you're asleep, we give you a combination of pain and anti-nausea medications, so you should wake up reasonably comfortable. That being said, being a little bit sore or feeling sick to your stomach are common complications after a general anesthetic. If you wake up uncomfortable, just let the recovery room nurses know and they'll be happy to give you more medication. Some of the more rare risks associated with a general anesthetic would include things like a bad allergy or a bad reaction to the anesthetic, or very serious events such as a heart attack, stroke, or death, although these complications are very, very rare. Some anesthesiologists may offer you a nerve block in combination with either the spinal epidural or general anesthetic. What a nerve block involves is placing numbing medication in your hip or your leg that numbs the nerves that either lead to your hip or your knee. This will be done before your surgery starts. Although the nerve blocks are very safe, there are some small risks with them, which could include, because we're using a needle going through your skin, bruising, bleeding, or infection, which could lead to a nerve injury. However, the nerve injury would just be in the form of numbness that could persist. The reason why they offer you the nerve block is for extended pain control after your surgery, and overall it's a very safe technique.
Spinal and epidural anesthesia are similar techniques in that numbing medication is placed in your back prior to surgery. Spinal anesthesia is the most common technique used for joint replacement surgery. With a spinal anesthetic, a very small needle is used to place numbing medication in the back. This can last several hours.
Right where my thumb is pushing, I want you to put your chin down, and then what I want you to do is push it out towards me like you're an angry cat or a rainbow or a shrimp.
An epidural is a similar technique, but a small plastic tube known as a catheter is left in your back. This allows us to give you numbing medication for a longer period of time. Once the spinal or epidural is placed, we will offer you sedation for the surgery. The amount of sedation will be tailored after discussion with yourself to determine what is both safe and acceptable to you. There are several advantages to these techniques. One includes excellent pain control before and immediately after surgery. There's also a decreased risk of bleeding with the operation and a lower risk of blood clots after surgery. There are some risks with these techniques. One is a small chance of not being able to find the right spot or giving you an adequate block for the operation. There's a less than 1% chance of developing a spinal headache afterwards. There are also rare but serious complications related to bleeding or infection where we place the needle, and in very rare circumstances, this can lead to permanent nerve injury. There is an extraordinarily low risk of heart attack, stroke, or death with these techniques. If you are offered spinal or epidural anesthesia, how you sit when the anesthesiologist places the needle in your back is very important. We have to place the needle that gives you the medication between the bones or vertebrae of your back, and these spaces can be quite small. By relaxing your shoulders, dropping your chin to your chest, and slouching your lower back out towards the anesthesiologist, these spaces open up to allow us to safely place the needle. Things you may hear include slouching, curving like a cooked shrimp, or pushing out your lower back like an angry cat. It is important that once we've placed the needle in your back, you don't move your position until we tell you it's safe to do so. After your surgery, you will go to the post-anesthetic recovery room. You will be in the recovery room until your anesthetic wears off. This can take more than an hour if you've had a spinal anesthetic. There, the nurses will check your blood pressure, heart rate, and oxygenation often. You may be wearing an oxygen mask. The nurses will also ensure that you are comfortable and offer you pain medication if you need it. You are sent to your bed on the ward after the recovery room.
Every blood pressure, perfect set. Good.
Successful joint replacement is a team effort. The anesthesiologist will work with your surgical team to ensure that you have a safe and comfortable anesthetic which is tailored to both your and the surgeon's needs.